Hi, everyone. Welcome back to our Q&A series. I'm Shakeela Rogers. I'm an intern with the BGSU Wellness Connection, and today I have Danielle Van Fleet with me today. Hi, Danielle.
Hi, Shakeela. How are you doing today?
I'm doing pretty good. How are you?
I'm doing pretty good. I'm just excited that we're keep doing these Q&A series and getting some sex
Yes.
ed out there. This is really exciting.
Yes, me too. And we have some new people with us today.
Okay.
Yeah, so how about we go ahead and introduce Jessica?
Hi, I'm Jessica Patton. I'm a senior at BGSU and I'm a campus co-organizer for It's On Us.
Awesome. I'm so happy to have you.
Yeah, thank you for having me.
Thanks. All right, and we have Emily and Erin.
Hi, my name is Erin, and I'm a fourth year at BGSU, and I helped Danielle during HIV and AIDS Awareness Week. Hi, my name is Emily, and I'm a fourth year student at BGSU, and I'm the president of the Student Wellness Network.
Awesome. Well, I'm so happy to have all of you guys with me today. Thanks for being here.
Thank
So let's
you.
go ahead and get right into the questions. All right.
Okay.
Okay, Danielle. So are you ready?
I'm ready. I'm excited to hear what we have to say today. This is a different setup for us, but I think this is going
I
to be so
know.
much fun to get other people's input in our sessions with us.
I know. I'm really excited. Okay, so I have my first question.
Okay.
Okay. So what is the difference between STDs and STIs?
So it seems that through the evolution of sexually transmitted infections, the name for the abbreviation has changed. Like way back in the day, it was VD or venereal disease. And then from VD, then it rolled into STDs or sexually transmitted diseases. And then we kind of it seemed like there wanted to be a reduction in the stigma surrounding a sexually transmitted infection, because a disease makes it seem like it's like chronic, it's forever and ever. And not all sexually transmitted infections are a lifelong or a chronic infection. So
Exactly.
it just changed from an ST to calling it an STD to an STI.
Okay. Awesome. I didn't know that, so I'm happy I know now. So is there a window period for getting tested for STIs?
So if you're sexually active, you should be tested at least yearly. If you're not experiencing any symptoms, you should be tested yearly. A lot of times as women, we think that when we go to the doctor and we have our annual pap and pelvic, that we're getting a sexually transmitted infection screen. And that's not always the case. Some insurances won't even provide an STI screen until a certain age. So that's a conversation that you really need to have with your doctor about when you should get a sexually transmitted infection screen, when your insurance will cover it. And of course, if you're experiencing any signs and symptoms of a sexually transmitted infection, you should go see a doctor right away. Not often, if you've had unprotected sex one night, could you go the next day and get tested and have a conclusive test? But you could still just go into the doctor and have that conversation with your doctor, and also kind of feel reassured, and by getting some education and some time one-on-one with your doctor.
Right. So it must take time for the infection to set in, basically.
Sometimes it just takes a little longer for signs and symptoms to occur, and it's different for men and women. Men can experience signs and symptoms much longer after the event than a woman can.
Okay. Wow. So I know, especially like in college and when you're younger, you hear about certain STIs and STDs. So what are the most common types of STIs?
Chlamydia, gonorrhea. I mean, those two are hot on college campuses. There is a strain of gonorrhea that's going around that has been treated so many times that we're really unsure if it's going to be able to be treated and cured. So when you get some of your gonorrhea, you go to the doctor, you get pills, you get a shot, and then you're clear of the infection. But there's a strain of gonorrhea that's going around that's becoming what we call medically resistant. So the medication is not treating the virus because it's been treated over and over and over. So those are just two, real hot STIs. And then herpes, which is skin-to-skin contact. That doesn't even have to be penetrative sex. That could just be body parts on body parts. HPV, hepatitis can be transmitted sexually. There's trichomonas. Those
Wow.
are the main ones.
Okay. So I also know that like certain people have different symptoms when it comes to contracting those STIs. So what are common signs of STIs?
For women, for women and men. It's a drip from the penis or the vagina. For the vagina, like a thick discharge that's not normally there. It can be frothy. It can have an odor. If there's any sort of spots, lumps, bumps, anything like that, those can be warts. So it's about just being able to even look at your vagina or your penis and like take inventory of what it looks like, because so often we're like, oh, we're just not going to look at it because it's down there and just it's uncomfortable for us to deal with. But if you're going to be sexually active and you're going to be giving your body to somebody, you really need to take a look at what your vagina looks like or what your penis looks like, what your testicles look like, so you know if there's something that is wrong. Discolorations, lumps, bumps, drips.
Yeah. So on the topic of talking about this, what should someone do if they feel that they have contracted an STD or STI?
Right to the doctor. Right to the doctor. Do nothing else. Don't go on the internet and try to research it on WebMD. Don't try to talk to your friends. Don't try to solve it on your own. Call your best friend's, mom. Just go to the doctor.
Yeah, right away. Go.
Yeah. And then after that, and then if there is a sexually transmitted infection present, then there does come that hard conversation with your partner. Because if you don't tell your previous partner, that you did test positive, then they could go out and have sex with somebody else and infect and infect and infect. I have this chart that we often show in my classes. It's called a sexual exposure chart. I don't know how well you can see this. Can you see it?
Yeah, a little higher. Perfect.
There you go. So like if you've had sex with one person, you've had sex with one person, right? I mean, but if you have had sex with 3 people, it's more like you've had sex with 7 people, and so on. So if you've had sex, let's come down here to 16 people, then you've had sex with an estimated 4,095 people. Because you have to think, when you're having sex with somebody, you're also having sex with everybody else that they've had sex with. So, you have to have those hard conversations with your partner. And and when I do testing, HIV testing, and I'm talking to people about like, do you ever talk to your partners about getting tested? I hear a lot of times like, no, that's very uncomfortable. Like I could not answer that question. But if we're willing to give our bare penis or our bare vagina to somebody, we should be able to really get down there and ask those nitty gritty questions. When is the last time you've been tested? And if they say they've been tested, can I see your results? Because when you get an HIV test with me and it's negative, you get a piece of paper, a certificate that says that you're HIV negative. If you go to a doctor and you get tested for HIV or a sexually transmitted infection, you get a piece of paper that's going to tell you your results. Just ask them for that. And I know those conversations are uncomfortable, but they're important.
Exactly. And they're absolutely necessary. And like you said, if you can give your body to somebody, then you should be able to have that conversation.
Yes.
Okay. So what are some long-term effects of an untreated STI? Because I know a lot of people, it can go a long time without it being treated, and it can get really bad.
Yeah, so for women, you can get pelvic inflammatory disease, and that could lead to complications in getting pregnant.
Okay.
Yeah, it can lead to some pretty nasty infections in the reproductive system.
Okay. Are there any effects for men?
I'm going to be really honest, and when we talk about these things, we usually talk about, the effects on the female reproductive system. Men, of course, if they let it go, there's a lot of damage that can be done to the urethra and to the penis as well. Sterility can happen, but it's not as common as with women.
Okay. Well, that was my last question that I have for you. So I'm going to go ahead and pass it off to Erin.
Thank you, Shakeela. So my first question is, which STIs are curable and which ones are chronic?
So chlamydia, right now, gonorrhea, those are going, and trichomonas, they're all curable. HIV, where was I going after HIV? And hepatitis, there's vaccines for hepatitis. If you were to get hepatitis, there is medication for it. And some people think that like bacterial vaginosis is a sexually transmitted infection, and it's not, but it's kind of lumped in that same because it's a bacterial infection that can happen due to sex, and that one is also curable. So the incurable ones are going to be HIV, HPV, and those two, sorry.
All right, thank you so much. So going from there, what are some resources for individuals that have contracted a chronic STI?
Yeah, so I just always recommend that people are in medical care when they do have a chronic illness. And if you're not comfortable with the doctor in which that you're seeing, it's okay to say that you're not comfortable and get a new doctor. Because it's your medical care, and that's really where you need to start. There's always, online platforms like chat rooms and stuff that, just tread very lightly, but at least it could be an area of support. I know with HIV, we do have support groups, and that is very helpful for folks who are experiencing HIV, and maybe especially in the very newly diagnosis stage, just to know that they're not alone. Oftentimes, because safe sex education and support around safe sex isn't very common, folks, if they were to get an STI, whether it's curable or chronic, they still feel like they're alone, and they'll think like, what did I do, and how could I have done something differently, and kind of feel like they did it. But it can happen to anybody. All it takes is having unprotected sex one time with somebody. So it's just really important to have support personally and medically.
Yeah, I agree. I agree that support is the most important. So how would you say one can manage a chronic STI?
Say that again.
How can one manage a chronic STI?
Okay, so managing, you mean like medically, or so medically, you want to make sure that you're taking your medications. Sometimes folks will have a feeling of denial, and they won't want to deal with their chronic STI, and they'll just let it go. And like herpes, if you don't take the medication as prescribed with herpes, it can be very painful. The outbreak is painful. I've heard of some people having trouble sleeping, having trouble wearing underwear or clothing. So the medication is there for a reason. So, and if you were experiencing any side effects from any medications, talk to your doctor and see what can be done. Same thing with HIV. We want everybody to be taking their medications every day as prescribed. That way we can lower the amount of the virus that is in the body. According to the Center for Disease Control, if somebody gets the virus to what is called undetectable, which means even lab tests can't detect that the virus is in the body, that means that they cannot transmit their virus to somebody else. It does not mean that they're cured. It just means that the virus is being managed. So it's very important to take the medications and to have personal support as well.
I see. So is it true that chlamydia can cause infertility in women?
Yeah, that's one that I was talking about earlier that could lead to pelvic inflammatory disease. It's not like if you get chlamydia, then you're going to get pelvic inflammatory disease. It's if you let chlamydia go untreated for too long, then that is a possibility.
Okay, so going back to the topic of herpes, would you say a cold sore is herpes?
It's different. So it's herpes simplex 1 and 2. So the cold sore is not the same as the herpes that is in the groin.
Okay, so my last question I have for you is hepatitis an STI?
So, hepatitis is a very, very tricky little situation. So I normally don't read, but hepatitis and I'm not as up on the hepatitis. So and I'm not afraid to say that I'm not very hepatitis smart. So hepatitis B is transmitted through blood, semen, vaginal secretions, and saliva. So therefore it can be transmitted sexually, as can hepatitis C. but it's less common for hepatitis C to be transmitted sexually. It's more prevalent for that to be transmitted through injectable drug use, so sharing of needles. There is a vaccine for hepatitis B.
Okay, thank you so much for answering all my questions.
You're
So
welcome.
I will go to Jessica next.
Okay.
Hi, thank you. So my first question is, like, what are the precautions that someone can take to help with the prevention of STIs?
So condoms, whether it be a condom on the penis, whether it be an internal condom or also called like a vaginal condom, dental dams, which is a sheet of latex that you can put over the vagina or the anus if you're going to perform oral sex onto the vagina or the anus. It will protect from any secretions that could get into the mouth. Anal secretions, even right now in COVID, we're telling people to not do any oral sex onto the anus because that can transmit COVID. So don't do that right now. And if you are, you want to be using precautions and using the dental dams. If you don't have a dental dam, because it's not something that is readily accessible, you can use plastic wrap and put that over the vagina or over the anus to protect your mouth from taking in any of the fluids that can transmit the sexually transmitted infection, because you can get an STI on your face, in your throat, in your eyes. So you want to protect yourself that way, as well as penetrative sex. And just getting tested. If you're having new partners and you have that conversation, just go in and get a test.
So how often should someone be getting tested for an STI?
For HIV, we recommend that folks are tested depending on their risk. So if you're having new partners regularly and you're having unprotected sex regularly, or if you are often engaging in needle use, then we recommend to be tested every 90 days for an HIV test. If you are in a couple of new relationships a year and you are infrequently using condoms every 3 to 6 months, I recommend a yearly test for sure. And for a sexually transmitted infection like chlamydia, gonorrhea, trick, any of those, maybe at the onset of a new partner. Maybe if you have had a risky interaction, a one-night stand, you've had sex with somebody and then you hear from a previous partner that they had a sexually transmitted infection. Even if you're not going to get tested, just go on to have the conversation with your doctor. That's what they're there for, your nurse practitioners, somebody, just to kind of alleviate any sort of anxiety, because there's a lot of anxiety around unprotected sex and sexually transmitted infections.
Yeah, so if you do test positive for an STI, can you still have like casual sex?
So after you've taken all of the medications and you've gone back to make sure that your test results are negative, if it's one of those treatable STIs, chlamydia, gonorrhea, trick, you can resume having casual sex as soon as you are no longer taking the medications you've tested negative. Somebody who's infected with HIV can have and herpes, they can have a very healthy sex life. It's just they have to tell their partners that they do have HIV or herpes and have that conversation and use condoms and protect each other.
Okay. So is it possible to become infected with an STI more than once?
Yeah, you can, and that's like the problem with the gonorrhea. That's why it's been treated and treated and treated, and it's becoming resistant to the medications. And you can get a sexually transmitted infection more than once. It's not like once you get it, then you're resistant to ever getting it again. You can totally get it again. And then the next problem is if you have it and your partner has it and you guys have not treated it, or one of you treated and the other one didn't, you're just going to keep passing it back and forth until you take the medications, don't have sex, and get a negative test result with those chlamydia, gonorrhea, and trick.
Oh, okay. So if you go to your doctor, are there vaccines offered to prevent an STI?
So there's vaccines for hepatitis B and HPV.
Okay. And then again, like if you go to your doctor, like can you get a pap smear? Like does that treat or prevent an STI?
Well, pap smears are really important so that your doctor can keep an eye on your reproductive system and notice if there's changes, and test for like precancer cells, but also just the fact of going to the doctor. And when you're in there, they don't always test you for an STI, so just make sure you're asking. And a lot of doctors' offices don't always test for HIV. So you have to request that. It's a special consent form, and then it's a lab. So just from your pap and pelvic, they're not doing an HIV test. You can't test for HIV during a pap and pelvic. So you want to make sure that you're talking to your doctor and specifically asking for an HIV test.
Okay, that's really good to know, because I honestly thought like whenever like they were doing that, they were like testing for everything. So thank you for letting me know that. Yeah.
You're welcome.
And then Emily, I'm gonna pass it on over to you.
Okay. Hi, Danielle. My first question is, if someone is in a monogamous relationship and develops a STI, does that mean their partner cheated?
Well, that's kind of a tricky question because it depends on how long has this monogamous relationship been going on. Because sometimes, like HPV and some others can kind of lie dormant in the body. Herpes is one of them. And then stress can kick up in the body. And when our bodies are stressed, then our immune system is compromised. And then if the HPV or the herpes was dormant, then it can now rear its head and show signs and symptoms. So it's not necessarily, but if it's something like chlamydia, gonorrhea, trick, and you've been in a relationship for months, then the likelihood that you got the sexually transmitted infection from one of you not being in the monogamous relationship is very likely, because you're not going to get the chlamydia, gonorrhea, trick from a toilet seat, from doorknobs. You're not going to get HIV from any casual contact. So, but if it's like you've agreed to be in a monogamous relationship and you're like in like month 1 through 3 and something like the herpes or the HPV gets transmitted, it doesn't necessarily mean within those 3 months that the person was not monogamous.
Okay, thank you for clearing that up. My second question is, are there any behaviors that increase the likelihood of contracting a STI?
Not using condoms. So like if you're going to go out to a party or to a club, or you're going to go out into a large group setting, I always recommend that you have like 4 condoms on your person, 2 for you and extras for your friends, because it's important. And sometimes, especially in college, there's partying, and then there might be alcohol use, and then your mind isn't as aware as it normally is, and you might engage in some sort of sexual behavior that you normally would not. And if you don't have a condom, and if you don't know that person, then then you're going to wake up the next day and you're going to be nervous. So just always have a condom, and have a buddy system. Take care of each other.
Okay, my last question is there a way to get condoms for free?
Yes. So when you get tested with me at BGSU, you get free condoms. I know the Wellness Connection has free condoms. Most RAs have free condoms. The health department gives out free condoms. And also, because we all love to get fun mail, ohio.gov will send you free condoms. You'll get 1 order per address. You have to be over 16. You get like 8 condoms, some lube, and like 2 dental dams. And you can custom order it. So if you need extra large condoms, or if you need non-latex condoms, they can put those in there for you as well. And they'll just come right to your door.
Okay, thank you.
You're welcome. You guys, these were some really great questions. Is there anything else that we didn't talk about that you want to ask?
Yeah, I have one more question. So why is there such a stigma around STIs and STDs? And what would you say, how can we demolish the stigmas around them?
So I've been working in HIV for much longer than I would like to admit, because then I'd have to admit how old I am. But throughout my entire career, we've been working on reducing the stigma. And I think that it's really surrounded, like when people come in and talk to me about getting a test, they say, oh, I only have sex with clean people. And that's where we have to get away from saying I only have sex with clean people, because the opposite of clean is dirty. Therefore, if you have, or if you've ever had a sexually transmitted infection, then you are dirty. And that's not true. There are very high rates of sexually transmitted infections, especially among college age folks, because you're out of the house and you don't have curfews, you don't have anybody to tell you what to do, and you are exploring yourself sexually. I think that it really starts with our conversations that we have with our friends, with our peers, and our classrooms, and just because I can tell you guys all day long, like, don't stop saying dirty. That's really, really shameful for somebody else to hear. And then if somebody does have a sexually transmitted infection and they haven't disclosed it in a friend group, and they're like, I only have sex with clean people, then that's going to just perpetuate that fear and that stigma of like, there's something wrong with me. I did something wrong. You didn't do anything wrong. You had sex with somebody, and we are sexual beings birthed to death. And it's great to have sex, and I want everybody to have a lot of sex. I just want the sex to be protected and healthy and consensual. And stop shaming each other. Stop shaming what it is that people want to do in the bedroom, and shaming people for having a sexually transmitted infection. This is why I like doing these things, because I really think it starts with your peers, and it's educating you guys so that you can go out and educate your peers about I don't want to say normalize it, because I don't want to say like, oh, it's fine that there's been a sexually transmitted infection, but it happens. And we need to stop saying things like dirty and clean. It's inappropriate to say those things. If somebody has been diagnosed with a sexually transmitted infection, move on.
Yeah, thank you so much for answering that.
You're welcome. Anybody else?
All right. Well, thank you all so much for your questions. They were amazing. Danielle, you are always amazing. I appreciate you so much for coming on here and answering these questions. And I thank you ladies for being a part of this. It means so much to me, and I think we did good today.
Yes. Thank you guys, and thank you all for being here.
So if you have any more questions or have any questions, you can click the links in the description box below, and we will see you guys next time. Bye.
Bye.